I'm Larry Reed with Soul of Finance, and I'm here with Nino Gonjilashvili, who is the CEO of VisionFund in Mexico. So, Nino, thank you for joining me today, and thank you for helping all of us around the world as we think about how we respond to this global pandemic.
Thank you, Larry, for having me. Thank you.
So, Nino, first to learn some more about VisionFund Mexico. Where do you work? How do you work? What sort of operations do you have there?
Just last week, VisionFund Mexico celebrated its 23rd year anniversary.
Congratulations.
In general, we always celebrate it with a little bit of fiesta and the cake right. And the candles.
Good Mexican style.
Yeah, good Mexican style. But this year it was a little bit different, as we have been having all the emergency meetings all the time. So it was just quiet and just a message to our colleagues and employees all over the branches.
Right.
Just a celebratory message, and but we hope that when it's over, we can do it.
Right.
We can
right. And how many clients do you have now?
We have 50,000 clients,
okay.
Around $22.7 million portfolio.
Okay.
And we impact over 61,000 children.
Right.
Mostly our clients are women. We have 88% women. Our portfolio is mainly concentrated on community banks and group loans, 97% of it.
Okay.
We have 3%, very low percentage of individual loans. And our rural and urban clients are 63% rural, and the rest is urban.
Okay. And are you around Mexico City or outside?
We are in different states, estados, as we call here in Mexico. We don't have Mexico City, but we have some surrounding areas around an hour and a half drive from Mexico. But we are mostly also in rural areas in Veracruz and in Oaxaca, etc.
Okay, good. And how has Mexico responded now to the coronavirus pandemic?
I would say that I think that the people in general are responding more and earlier than the government. For now, only schools have been closed as of today. Last week, schools were still open. They're also closing the bars and the restaurants and the museums and all kind of events. So you cannot have the event over 50 people attending. But the other drastic measures that we have been seeing in Latin America, like the quarantines, it has not been done here yet. The government has been commenting that mostly this will be the measures that will be impacting the poor people, the vulnerable people. Right. So for now, they are trying to not to take drastic measures, because we don't have formally or officially high numbers of infected people.
Right. So what impact is this having on your clients now?
The sales are decreasing. The economic activity is decreasing every single day. Even here in Mexico City, where you cannot probably cross the street because there are like 20 people waiting.
Right.
Now you go down and there's nobody.
Right.
When you go out, people are not in the restaurants or just having lunch. So it's more, you can see it more in the city, but fortunately we don't have clients here. But also our clients have been calling us saying that their economic activity is going down, and how can we respond and what we can do for them.
And how are you responding? How are you changing your operations now?
Oh, that's not so.
Every day about this, right?
I know. The thing is that we've been trying to do lots of changes since I joined. However, we had all planned out during a few years. As you cannot have the changes happening every single day and 1 month. However, now we are trying to do everything as soon as possible, The first thing was we formed the emergency committee at the head office level and emergency committee at the branch level. We also provided our employees the tools for remote work, so they can join and do all kind of conferences with Zoom, Skype, telephone, WhatsApp, whatever's available around. So starting today, most of our people from the head office are working remotely from home. Only the senior management and few key people, we are still trying to see how it works and respond to the emergencies. We are also making available the voluntary insurance to our clients. We have this voluntary insurance, health insurance. However, the clients who did not buy this insurance when they took the new loans or did the renewals, now they're invited also to apply for it because this is a very good insurance for the clients, especially in the regions and in the rural areas, so they can have an access to hospitalization up to 10 days and accident coverage and even the funeral expenses. Hopefully not necessary,
right.
At least it covers that.
So this insurance, you were already selling it before
We've been selling it. We just started just a couple of months ago to sell it to our clients, but it's a voluntary insurance.
Right.
So clients who wanted would buy that, and clients who would not. So by now we're just telling them, just buy it. It's cheap.
Right.
We have pandemic and it covers it, so just go ahead. And we made it available, even though according to the policy, it's only when you renew your loan or take on a new loan.
Okay.
But at least we are giving it to our clients. Also, we made this available to our employees.
Okay.
This insurance. And we are also working on with the insurance company on a new product to make it available to the general public in the branches and in the states where we work.
Oh, wow. So you're working with an insurance company that is supplying
Yes.
insurance.
Yes, we are working with brokers.
To sign up new customers even in the midst of the pandemic.
The thing is that probably you have to, in today's world, you should be able to respond quickly.
Right.
And that's what we are doing. Yes, we are working on the weekends, and we just this new insurance product in 2 days. Now we are working for the general public that should be ready hopefully in 5 days.
Right.
And because if we wait 1 month, then
right.
it makes no sense. Right. So we are trying to respond as quickly as possible to the.
That's great that you're able to do that.
Of the public, yeah. We are also introducing a new policy about the loan restructuring that we never did before.
Right.
Even though VisionFund does have a policy for it, so we adapted it to the current situation. We formed a committee also, so we can help our clients and who want to pay, but they can't because of the current situation, to help them and restructure their loans.
How is that going to work? Will they not have to pay for a while? Will they have to continue paying interest?
So for now, the thing is that we give them the grace period from 1 to 3 months.
Okay.
So it will be depending on the client loan sector, the term, what he or she wants, etc., etc. Yes, and also extending the repayment period so the repayment amounts are lower and they can afford it later.
Right. Very good.
Yeah.
And are your clients still meeting in groups with their community banks?
No, so also starting today, we canceled all the group meetings.
Okay.
Until the further notice. And mostly our loan officers who attend to the clients will be in contact with them via WhatsApp or telephone again. Okay. Yeah, all the meetings are canceled.
Okay, so that you're wanting your loan officers then to get to them by telephone.
Yes.
Or some means to contact them to stay in touch, but they're not going to meet together.
No, not anymore.
Okay. And what about payments? How do you receive payments
Yeah, that's another thing. We receive our payments and we do disbursements in the traditional banks,
right.
Because we are not a bank, we are not a regulated financial institution. We cannot have the bank branches, and there are a lot of other things that for now we cannot have. So we have these contracts with the traditional banks. However, they already decreased their operations to 20%.
All right.
Which is very difficult for us. However, what we're trying now is to see if we can work with the debit cards, and if we can have the contracts with the banks who give the bank accounts and the debit cards for free of charge to our clients, so they don't have to pay the monthly or annual fees on them. And we are also seeing if we can take the payments via cards in our branches. So we are trying to see what other means of payments and disbursements we can do. We do have the other contracts also with the shops, with the pharmacies, not so traditional means of payments, but we are still trying to see what we can do in this digital world to give the clients the opportunity to meet their payments. We will see how it works in the next few days.
All right. And what about your staff? I mean, they're not meeting with clients physically now. All right. What other things are you doing to keep your staff safe during this time?
So we already communicated to our staff that everybody who is over 60 or pregnant or has a chronic disease, they have to stay at home and work from home.
Yeah.
And we also bought in bulk the antiseptic gels, also the industrial masks for our branch staff. We canceled the meetings. We are also trying to give them the different times when they can go to the office and work for now. And in the head office, where the concentration of the virus is more in the city of Mexico, in the Mexico City, so most of the people are already working outside from their home. The thing is that we are trying to follow to the government decrees and recommendations, and for now the recommendation is if you can work from home and wash your hands, and trying to do as much as possible. Probably the good thing in this case is that we don't have a lot of staff who are over 60. I mean, we don't have anybody from 400 staff, so it's going to help in a little bit for us.
Right. And if this crisis goes on for several more months, how would you help your clients through that? How would you help them manage with limited income coming in?
Yes, I don't have a recipe for now. We are trying to think of new things every single day. I've been reading, it was yesterday, I think also, that in Latin America, where most of the population lives day by day. So if they don't make a sale or if they don't work today, they cannot eat today, not even tomorrow. So I even don't know how our communities, our people can just stay at home. So that's why we are trying to give them the means like the insurance. We will be also working with them for the reactivating their businesses afterwards. We want to make it simple for them to repay whatever they can, to restructure the loans, to answer their questions. So we are on Facebook, on the telephone, so nobody stays without an answer. So for now, that's only this, because if we have this drastic measure that other Latin American countries have been taking, and we are all closed out by the government decree, for now, I don't know what else can we do than just keep in touch with them by phone and by internet. That's it for now.
Yeah. And I think with your role being in so many communities and being so close to the people, you may have an important role to play in communicating what's going on, both to the government, but also to World Vision and others who are responding to the crisis.
Yes, we are trying to keep as close as possible, not physically, but as close as possible to our clients, and to give them all the information and the facilities and the help assistance.
Oh, good. Well, thank you for what you're doing, and my prayers are with you and with all your clients as well. And thank you for sharing. I hope others can learn from what you're doing, and I hope you're able to learn from others as well, as I'm able to get other interviews done and put them up.
Great, Larry. Thank you very much.
All right. Great to talk with you.
It's going to help a lot, I think, us sharing the information.
Right. I think there's a lot of good ideas out there, and as long as we keep talking to each other, we can share them and learn.
Great. Thank you, Larry.
All right. Thank you, Nina.